This PowerPoint accompanies the Word document Exam for Review that you find in your My Courses site and covers the most important information being tested on Exam 4. Please also refer to the information on that exam guide. On page 252, you will find the assessment questions about dizziness that are important to diagnosis. Asking the person to describe rather than prompting that person is very important to getting an accurate assessment. There are several types of headaches, and appropriate treatment is dependent upon a correct diagnosis. The three major types of headaches and their location, presentation, duration, and type of pain are described on page 265 and in this chart. If you can describe these three types of headaches, you are prepared for any headache questions on the exam. In Chapter 15, you learned several terms related to the eye. Presbyopia, which is the inability of the lens to change shape or accommodate for near vision. Photophobia, the inability to tolerate light. And diplopia, which describes the perception of two images of a single object. The Snellen test is the most commonly used and most accurate measure of visual acuity. The person is positioned exactly 20 feet away from the chart and uses an opaque card to shield one eye at the time during the test. If the person wears glasses, they will be tested with their glasses on. If the glasses are only used for reading, then the person removes their glasses, as far distances will be blurred with glasses on. Page 284 describes how to interpret the results, and you will most likely have a test question that asks you to identify the correct interpretation of the Snellen test. In Chapter 16, you learned about hearing. Conductive hearing loss involves a mechanical dysfunction of the external or middle ear and can be caused by impacted cerumen, foreign bodies, or perforated tympanic membrane, among other causes. Sensory neural perceptive loss is a condition of the inner ear, the cranial nerve number 8, or the auditory areas of the cerebral cortex. On page 322, you find the note to examiner clues that you as the nurse can use to identify an unreported hearing loss in your patient. Review these for the exam. Also, on page 325, you will find the directions for visualizing the tympanic membrane of an adult pull up and back on the pinna of the ear, or an infant or child under 3 years old pull down. On page 323, review the difference in air and bone conduction and the appropriate test for each type of conduction. The tuning fork test on page 343 can be a little confusing, but in the Weber test, the tuning fork is held on top of the head and the sound is conducted equally to both ears in a normal test. In the Ryan test, the tuning fork is held first behind the ear, and then when the sound goes away, it is held out from the ear. In a normal test, hearing sound should last as twice as long by air conduction after the sound is no longer heard with the tuning fork behind the ear. And finally, on page 331, you will find the age-appropriate techniques of detecting hearing loss. Note that the room should be quiet and the baby should be content, not crying, when you make a loud noise like clapping your hands or squeezing a toy to check their hearing. You will have a test question that requires you to identify the correct age-appropriate test for hearing. In Chapter 17, we learned about the nose, mouth, and throat. The condition of the teeth and gums is an indication of the person's general health. Pages 350 and 356 discuss this relationship between oral health and general health. Note also on page 356 that grinding of the tooth surface and accumulation of plaque can lead to dental caries, while malocclusion also contributes to poor oral health. An abnormal would show malocclusion and protrusion of the upper and lower incisors, which prevents normal chewing process and impacts the ability of the individual to process their food. Biting down on a piece of litmus paper can show if the upper and lower teeth are properly aligned. Front upper incisors should only slightly override the lower incisors in a normal assessment. In the chapter on skin, hair, and nails, as you review the chapter, think about the function of the skin in terms of assessment, why and what you're looking for. Assessing the changes in lesions is discussed on page 209 and is reflected on page 206 as the danger signs that we look for to assist in diagnosis of a malignant skin lesion. Note that skin turgor can be assessed by pinching up the large folds of the skin on the anterior chest, but it can also be assessed by pinching up the skin on the forearm or the back of the hand. You will need to be able to identify either by picture or by description the differences in stage 1, 2, 3, 4, and deep tissue injuries, pressure injuries, that are described on page 230. Note also that an important thing to look at is on page 223 to 224, and that is detecting color changes in light and dark skin individuals, particularly for pallor, cyanosis, and jaundice. You will have test questions on this. In chapter 18, we learned about breast exam. And it's important to note in your description, it described that the tail of Spence is the upper outer quadrant of the breast tissue and that it is the site of most breast tumors. So a thorough breast examination, whether by the provider or a self-exam, must include this quadrant. Also note that the Tanner staging tool is used to identify normal female development in the adolescent. You do not need to memorize the chart. Also be able to identify the types of breast exam and that the vertical strip pattern of assessment is best for identifying breast masses. In health promotion, we talk about mammography screening, and you need to understand the abnormal findings of dimpling, edema, and nipple drainage and how that impacts an assessment of a breast disease. In chapter 29, we talked about male genitourinary system, and as with girls, the Tanner staging tool is used to establish maturity, sexual maturity in boys. Note that the risk factors for bladder cancer include smoking, which is responsible for 2/3 of all bladder cancers, occupational exposure to dyes and other chemicals, and the initial sign of bladder cancer is painless hematuria. The definitions for subjective data are on page 688, and the process for testicular self-examination is on page 697. It is important to teach your clients how to perform this as a teenager, since most testicular cancers occur between ages 15 and 35 years of age, pointing out the timing once a month, to do it in the shower as warm water relaxes the scrotal sac, and to examine, check for, and report any changes immediately. In chapter 26 about the anus, rectum, and prostate, please review the terms meconium, gastrocolic reflex, melena, steatorrhea, and dyschezia. Also look at the risk factors for colorectal and prostate cancers from the PowerPoint on this chapter. In chapter 27 on the female genitourinary system, please learn these data terms: menopause, menstrual history, last menstrual period, which is abbreviated as LMP, menarche, amenorrhea, menorrhagia, dysmenorrhea, and urge or stress incontinence. Pregnancy, infants, young children, and adolescents are discussed in chapters 31 and 29. Chapter 31 focuses on pregnant patients, and the first 3 trimesters of pregnancy have distinctive characteristics, and you should review the general questions that we ask women who may or are pregnant. Normal findings include that as the fetus grows, the gestational age and the fundal height in inches correlate. Chapter 29 focuses on the assessment of infants, young children, and adolescents. Of note to remember is that infants are typically examined supine on a warming or examination table. You should also remember the assessment techniques for young children, adolescents, and older adults that you learned from Chapter 3 earlier this semester. The APGAR score is conducted at 1 and 5 minutes after birth and indicates how well the infant is adapting to life outside the uterus. Chapter 30 provides a short discussion of documentation. Review the information on pages 793 to 4 about the assessment of a hospitalized patient. Note that offering water, if appropriate, is described on page 794, which gives you a lot of information about hearing, swallowing, the ability to follow directions, and if the individual can cross midline with their arm to take the cup of water from your hand. It is important to also review the rationale for the safety alerts that you find in electronic documentation and the components of SBAR reporting. Chapter 32 talked about the functional assessment of the older adult. Dementia, delirium, and depression are three distinct conditions. Dementia is the chronic progressive cognitive decline, while delirium is an acute condition which can be reversed, and depression, which is an overwhelming sense of sadness. It is important for nurses to distinguish between these conditions. Also, just remember to review how to evaluate functional assessment. These assessments are described in the chapter and are a key to safety for the older adult. They are described on pages 826 and 827. There will be test questions on these assessments. Review the information on the cognitive assessments found on 828 and 829. Note that the Montreal Cognitive Assessment is the best test to identify mild cognitive impairment in an adult. With all older adults who are no longer able to live completely independently, it is also important to assess the caregiver, who often becomes overwhelmed as caregiving responsibilities increase as the patient declines. And finally, review important health promotion information about activities of daily living and lifestyle, exercise recommendations, and the information on when to stop driving and tips for getting the older adult to stop driving. While all the information in these chapters is important, the information that has been provided on this PowerPoint and in the Word document review help you focus on the information that will be included on the exam 4. Thank you.